I want to welcome everybody. Thank you so much for coming and taking the time out of your day to learn about how you can help yourself. With healthcare, I think the best thing that we can do as practitioners and providers is to offer free seminars so that the public can get educated and just be better advocates for themselves. My name is Gina Royone. I'm the owner of this practice, Physical Therapy and Balance Centers, and we will be kind of co-teaching today, myself and Chris Piercy, which I'll introduce in a little bit, and Clemmy Consalvi. Each will be kind of offering a little bit of different piece of the puzzle of what can help you. I have the part of educating you on the kind of nooks and crannies of what is lymphedema and in my opinion, maybe the boring part of it. But it's necessary to understand it so that you can understand, okay, I get it now, how can I help myself? Has anybody here ever been diagnosed or suffers with lymphedema?
For me, one doctor say I have lymphedema, two doctors said I don't have it.
Okay.
I don't know what to do, where to go.
Good. I'm glad you're here because we can definitely figure that out for you today. And,
I have lymphedema in my legs because of radiation,
okay.
extensive, and it also ruined my skin, made it very thin, and they told me I wouldn't have this discoloration, but I do.
Okay.
And I don't have my, see how easily I bleed. I don't have my support hose on today because it's summer, 90 degrees, it's very hot. But around the area that it was radiated, it's very puffy and swelling.
Right.
And that's fluid.
Correct. And they call it secondary. That's more of a secondary lymphedema. So without further ado, basically there are two circulatory systems in the body. Everyone's very familiar with the blood system, the venous and the arterial circulatory system, but often overlooked is the lymphatic system. There's a whole nother network of vessels that connect that serve a very, very important function for the body. It was first really discovered in 300 BC in Greece. Medical journals started to kind of look at, okay, there's another system here at work. But it was studied, it wasn't for about another 1,000 years that they actually identified it and coined it the lymphatic system. Basically, the word lymphatic, it translates to pure water, because the lymphatic system is basically responsible for purifying our body of toxins and getting rid of bugs and disease and metabolism. So it's basically our purifying system. It basically is found in clusters, large clusters in the neck, in the axillary area, and in the groin. And then it connects with this very fibrous network system throughout the body too. And each cluster really has a job in itself. So the neck is going to take care of, the main one that will take care of a lot of the chest, the arms. Each system will take care of the metabolism in the arms, and in the groin, the legs. And then the main duct is right across the diaphragm. When you take nice diaphragmatic breaths, basically it creates kind of a start of a pump or a suction mechanism to get everything moving so that the body can eliminate waste. It's basically our body's defense mechanism. So every time you move your arms, you generate what we call metabolism from the cells, and it generates waste products. The lymphatic system is designed to actually take care of that metabolism and that waste and filter it through and get rid of it from the arms. Primary lymphatic organs are the bone marrow and the thymus gland, and then your secondary lymphatic organs are your spleen, your lymph nodes, and the mucosa, the mucous membranes that we have surrounding our organs. There's going to be a really awesome picture at the end of my talk that Clemmy's going to use as demonstration, but it's a nice fine network of anastomoses that connect across the chest, down the sides in the front and in the back, all working hard to kind of actually take away protein move the protein fluid, because lymphatic fluid is very thick, protein-rich fluid, and filter it so that we're not getting rid of all of our protein and become protein deficient. The fluid, if the system malfunctions, where the clusters get clogged, or they've been injured or damaged, and they don't have the ability to actually do their job, that thick fluid backs up into the limbs, or the torso, or the face sometimes, but most commonly in the arms or the legs. And it gets trapped between the layer between the muscle and the skin. And because the fluid, unlike people who have just primary circulatory problems that are on their feet for a long time and their ankles blow up, they go to sleep with their feet up and they wake up and those ankles are down, that's straight water. So that water actually can osmose through the membranes. But true lymphatic fluid is too thick and the protein molecules are too large, so you need an external pressure or force or intervention to kind of force it back into circulation, so then the body can then deal with it and excrete it and filter it somewhere else. Often when we treat somebody with lymphedema who's maybe had cancer or had damage to their lymphatic ducts, we have to kind of manually reroute it, and it moves very easily. You kind of can tell it where to go because it's so superficial, but we have to reroute it to the other more functional lymphatic ducts to help you.
Gina,
Yes?
will this work like several years after you've had the radiation?
It will work as soon as you have the problem. Yeah. Now, my heart goes out to people who have to live with this, because it is a bit of a chore on your behalf. It's something that you have to manage. It's not something that usually just goes away, although sometimes with the right diet and exercise and hydration and healthy habits, you can manage it, and maybe it can kind of be dormant, but you'll always be under risk factors for it. Actually, we're going to move into that. So it can be the primary or secondary. So primary would be more of cancer, lymph nodes removed. Sometimes if a person is very overweight and sits for a very long period of time and compresses their lymphatic ducts, that can cause a primary lymphedema where the lymphatic ducts have gotten damaged or overcompressed. Secondary lymphedema, which is much more common, I think, that we see, is basically when there's a problem with the blood vessels, with the venous insufficiency, where the veins have just lost their ability to really pump that fluid back up from the legs. It starts to pool, and because of that pressure and that pooling, that creates a problem actually getting rid of the metabolism from the legs. So you have, in addition to the water weight, you'll start an onset of that thick lymphatic fluid getting trapped between the skin and the muscle in the legs and in the feet. So we basically treat them the same, but the causes are not the same. And you have to, with a secondary lymphedema problem, you want to make sure that you're doing all you can to help the primary circulation as well, which also boils down to proper sitting, good exercise, proper hydration, good healthy habits. Sitting too long is really a nemesis for this kind of problem. Got to move. The muscles act like a pump. They help the body just get rid of stuff. So when we sit for too long, it's not happening. Often, sometimes we see it too where, and this is where I'll speak to you at the end of the class, that it gets misdiagnosed. There's another, something that looks like lymphedema that's called lipoedema, which often the docs will look at a limb and say, oh, that's lymphedema, and they'll send them for treatment for lymphedema, but it's not lymphedema. It's lipoedema is when the limb swells, but what's really swelling is the adipose tissue in the limb. So the fat tissue itself swells, and it really doesn't respond well to lymphedema treatment. And we can usually catch that pretty quickly. Also, some of the signs and symptoms that they seem to complain of a lot more pain in the limb than with lymphedema. Lymphedema is uncomfortable, but it's not generally painful. So what are the signs and symptoms? You'll have a gradual increase in the girth of the area, you know, and I'm going to use the arms and legs because that's where you most commonly see it. All of a sudden you'll start to say, wow, that feels kind of fuller. And then you'll notice it'll start to swell. And then over a little more time, you'll start to have what we call pitting edema, where you can put your finger in there and the fingerprint stays there. Whereas in healthy tissue, it'll just pop right out, but that will stay in there. If you continue to leave it untreated, the next step is there's so much pressure builds between the muscle and the skin that the skin actually breaks down. The body will always try to help itself, so if the skin breaks down and you'll start to form blisters that pop, and then they start to like leak the fluid out because it's very dangerous to leave it there. Continued ignoring the signs and symptoms often leads to cellulitis, which is a very serious problem of a skin infection that is a little difficult to treat. I mean, it requires very, very, very heavy antibiotics to really treat, and heavy medical management and sometimes wound care on top of that. And then finally, there is, it can go into what's called elephantiasis. That's more of an introduction of a bad environment, receives a parasitic type infection in there, and then that kind of, the limb ends up actually literally looking like an elephant limb.
But the groin lymphedema.
Yeah, it can go up in there. It's more, you know, torso, looks a little different, but more rare, much more rare. Usually it'll go down the whole leg, but it can go from the entire leg up into the groin. Do you have a specific question about that?
I swollen right here,
Okay,
and I have removed 17 lymph nodes,
okay,
and one oncologist said that is not lymphedema. Second oncology said yes, that is lymphedema.
okay. 50-50.
50-50,
I
right?
have to take a look at
Yes.
that. You'd have to see it, really, to
Where
kind
we
of
can
feel
go,
it out.
who can diagnose you really have lymphedema? Because my leg really not swollen right here, I'm swollen right here.
It probably is lymphedema, but you would go to a specialist. Like, we can take a look at it, people who are familiar and see it a lot.
So only physical therapists take care of lymphedema, or any doctor take care of that?
Physical therapists primarily take care of it, as far as I know.
OT and PT. And there's some vascular specialists that can
Okay.
help pinpoint a diagnosis. But
How I can
a
find
lot of
that?
this is based on when your surgery was. I'm assuming that the surgery was kind of recently.
That was hysterectomy cancer.
What year?
2 years ago.
Yeah. So it could be the onset of some of these things starting to present themselves. You're just bringing it up to the attention of the oncologist now, whereas a lot of people don't bring it up until it's more developed.
I had that right away after hysterectomy.
Yeah.
Swollen.
So it probably is. It's probably the start, and it would probably be worthwhile for you to do something to, you know, some sort of intervention so it doesn't become more. And perhaps it will become a little bit more, but you jumping on it ahead of time will be that much better for you in the long run. Yeah.
Yeah, and coming to learn about it. A lot of people will just won't take the time out of their day to really be proactive about their health, so I really am happy that you guys are.
Do you know any doctor where I can?
Yeah, after the three of us speak, we can give you some information about
Thank
a
you.
vascular doctor, but a lot of times it comes down to the therapist. Because
Okay.
all the doctors, as specialized as they are here in Florida or perhaps in other states,
Yeah.
they directionalize the patients to a therapist to get a more developed diagnosis of what that is. Only because the therapists, a lot of them have been seeing this for years and years and years, and they can kind of profile someone and say, oh, I've seen things like that a lot, or I've seen little things like that, or I've seen extensive things like that, and they're able to profile and give a much more in-depth diagnosis, whereas a doctor is going to be like, your vascular system, nothing wrong with it, but go see a lymphedema therapist, and they'll be able to just do the massage and techniques they do to try to reduce the problem.
Okay, so what can you do? What can you expect? Primarily, education is number one, kind of what the do's and don'ts are. So some of the do's and don'ts are Be careful of bug bites. When you go up in a plane, if you've been diagnosed with lymphedema, you want to make sure that you have a compression wrap on the limb that is swelling, because that can really trigger it. Bug bites also a big trigger. If you're a gardener and you've been diagnosed with lymphedema, make sure that you put in a good amount of bug spray when you're going out to garden. Keeping a prophylactic compression garment on the limb is helpful, and they have some really cool, jazzy ones for the arms. For the legs, they're a little more uncomfortable. There are other options, which Chris will get into when he starts to talk about this. But number one is really educating yourself and taking good care of yourself. And
How about if I will go to the dentist and, for example, I will have a root canal, it's a lot of bacteria, or implant. So what I should to do, how I manage this?
generally speaking, because yours is in the lower part, it's very compartmentalized. That your neck and your upper lymphatic channels should be functioning well enough to handle what's going on in the mouth. So I wouldn't worry that much about that.
Okay.
And then treatment options, where manual lymphatic drainage, where we kind of open the channels, and you can even do it yourself, kind of reroute the fluid, get the diaphragm to start suctioning. Compression wraps at first. When you come in with a very swollen one, we have to layer with compression wraps. They kind of look like short stretch bandages. I'll try to find a little display at the end if you want to see what it is. And that, has to be done often. And then you have, Clemmie's going to talk about a technique that she developed called neurospatial alignment. I won't get into that. She'll get into that, and then I think she's going to maybe, if anyone's interested, give you a little sample of her work. Compression pumps, which is Chris is going to talk about that. That's where at home, this is something that you don't want to be spending hours and hours at a doctor's office or a therapist's office all the time just getting this kind of passive treatment. This is a treatment that you can actively put on yourself to manage it on a daily basis. And proper exercise and then nutritional considerations are also helpful. So that's a cool picture of the 3 vessel systems that we were talking about, and I'm going to just turn it over. I'm going to introduce to you now Clemmie Consalvi. She created a technique called neurospatial alignment. She's also a licensed massage therapist, and she's going to talk to you a little bit about what she does and maybe give you a sample.
So the past 29 years, I've developed this procedure, and I approach things from what's causing the problems. So, of course, lymphedema is from, like she said, many different reasons. How I come about it is you think about the compression. If you have a water hose and you're using the water hose and you put something on it, it's going to cut the flow down, right? You're going to have backup in there. So let's take this for instance. With this being the lymphatic system, the green is the lymphatic, the other is the blood vessels and arteries, okay? So right here we have the joint. You see right here the shoulder joint, and through here comes the circulatory system, the lymphatic system. So a lot of us, when we're about our everyday work, most of us are doing forward type things, and most people's shoulders get rotated forward. The muscle's job is to support and protect the skeletal system. So when it gets tight, it's trying to keep it from getting injured. What happens, you take care, I call him bony, you call him slim, but you have a shoulder usually that would be pulled forward like this. What happens is this is scapula. The scapula has many muscles around it. You have the clavicle or the collarbone. So whenever it gets tight and the muscles are pulling, it presses down where the arteries and vessels go through. You have the brachial plexus nerve, you have different nerves that are going through the same track. So what I do when I want to correct that, I am looking for the origin that's causing it to rotate. So I put light pressure on tendons and our ligaments. Now a healthy muscle, tendon, and ligament will go contract, release. When it's been injured or attacked, it goes into spasm and it pulls short, or it goes into guarding, meaning it's locked down. It's not going to let anything happen to your skeletal system. But in the process, it blocks off the circulatory system as well as the nervous system. So I look for what's causing that to go in there. So the first thing I will do, like let's say the scapula, this is the scapula here, okay? You'll see it back over here on this side. What happens, it starts to pull down and rotate forward. And then you have these bones here where, you know, it's going to start pressing, as you can see right through here, this bone here, is going to press down on the lymphatic system, nerves, and vessels. So what I do is I come in, I put light pressure on the tendon and ligament, that starts to derotate. I work every area in here that gets that scapula back, gets that clavicle back up, and that starts to derotate the shoulder back out. So it opens up that flow once again. All right, so we have also, that's the upper limbs. Sorry. This is the lower limbs here. You can see you have the ileum right here, okay? All the lymphatic system will run through this area. Now when you have surgery, like you said you had surgery, right? Let's say you got cut in this area. And some women that have had hysterectomy, you know, they're cut right at the pubic bone area. What happens, your body starts to pull toward the area of the surgery, the scar tissue, adhesions, so it pushes down on the lymphatic system. And then what happens is the whole ileum starts to rotate, like it will rotate this way. If you're looking at this, it will rotate forward, and it starts to compress on other things in this area. So when that happens, I will go in there and work around the scar tissue area. And it's not myofascia or anything, it's very unique. Like I said, I put the light pressure on it, and I kind of do like an S figure, which will stretch and open up where that scarring is. And then I'll continue to put, you know, pressure along the ligaments and tendons around the inside and outside of the ileum and get that to derotate back. And in the process as well, it starts to go back. You look over here. The ileum will start to go back, and where the nervous system is through here, that will take that pressure off of that. Once you get the nervous system opened up, your body goes back to what we call homeostasis, which is normal functioning of the body. So that's pretty much it. Any questions? Okay.
Arm sleeve here and a couple other things I wanted to show you guys, but I wanted to kind of parallel some of the things that have been said in the last couple minutes here, and then kind of bring it right into the use of the compression pump. So how do you treat lymphedema? Once you kind of identify what it is and how it came about, how do you essentially treat it? So lymphedema massage and or bandaging is the more traditional approach to treating lymphedema. So it's, in a lot of ways, the way I kind of approach it is, it's a manipulation or compression through manual massage and or the use of bandaging. So it's actually quite primitive in nature. Gina was talking about the use of different applications to help kind of treat lymphedema, whether it's secondary or primary lymphedema. But some of the things that patients undergo to basically try to treat it is go to a lymphedema therapist, whether it be in an outpatient clinic or in some situations a home health. But in an outpatient setting, they'll do the lymphedema massage and or the bandaging, and what that does through the application of moving the lymphatic fluid as well as then compressing lower truncal section is a hysterectomy or some sort of intervention or obstruction of the lymphatic system in around this, the ileum here. So basically what you have is, in a lot of cases, lymph node or parts of the lymphatic system being removed. And I always use the analogy of taking like Route 95, right? And you have 5 lanes of traffic where it seems to run very efficiently when it's at its smoothest. And then you have an accident, and then now the highway is going down to 2 lanes. Well, naturally you're going to have a bottlenecking. So if they go in here and do some sort of intervention, aside from all the other secondary effects that are happening with the body trying to repair itself, you're going to have the lymphatic fluid that's going to be bottling here, whereas the other parts of the lymphatic system are trying to pick up where this is having a problem. And so some of that lymphedema massage also has to incorporate that lymphatic fluid to move to other parts of the body, whether it be the other side here, also in the knee. You can move it into the truncal abdominal region. Like Gina was saying, a lot of it's compartmentalized, so other parts of the body will sufficiently do that. And we see a lot of breast cancer patients, so they have a mastectomy or a lumpectomy, and intervention is happening here. And because of that, let's say it's the right breast, and this is either removed or partially pieces removed, then you have to have this lymphatic system is bottlenecking in this particular region, and so you start to have lymphedema, whether it's in the arm or in the breast, or in sometimes the neck and the clavicle and even the shoulder blade. So it's regional. What we do with the compression pump, and to answer your question, is yes, some of that stuff I consider is somewhat temporary, because lymphedema, secondary primary, it does not go away. If your body has it and let's say you're 60 years old and you have it, you will most likely have it in your 90s, your 70s, your 80s, and in your 90s. It can go dormant at points, and you can do other things to affect it very positively, but a lot of times it's always still present. There's use of certain things you can do to limit it or manage it. And what I want to talk to you guys about, aside from all the lymphedema massage and the wrappings and stuff, is the compression pumps. So these particular units, they've been around for 70 years. We have, at CarePoint, we have access to 5 manufacturers. This one particularly is a 6-chamber pump. So it works like a lymphatic massage where it compresses in segments. This one for it's a small leg garment. We have a medium and then a large, and then we have other widths that can accommodate. But this compresses in a sequential manner so that it more or less milks the limb. So a lot of times the swelling is worse in the most distal parts of our body, whether it be the hand or down in our feet and our ankles. So when the compression pump is applied, it applies its heaviest compression through here, and then it lightly tapers to a lighter compression as it goes up. It's very comfortable. It mimics a massage. It's this particular products. These products are covered by the insurances, not just one, Medicare, Medicare replacements, private insurances, and it is a purchased item. It's not a rented item like some other medical equipments that need to be re-upped with the doctor every so often. And patients utilize this stuff once a day or twice a day for an hour, and it helps them manage that edema, because it is up to you to basically utilize elevation, proper nutritional techniques, exercise, possibly diuretics even sometimes, a lot of times get utilized, but stockings and or the use of a pump. So one of the best ways I kind of always approach this is from a simple perspective, because it can get very involved, as far as structurally, the muscle system, the lymphatic system, the vascular system, but you leave that for the doctor and the therapist to kind of move through your body in that way, day to day, to manage it. And it means compressing the tissue and or moving the fluid out. If you can wrap yourself and massage yourself on your own after it comes to an end, that's great. A lot of people can't. The vast majority cannot. So they have to use some sort of intervention with a compression garment. Stockings are something else that are very, very helpful. So a compression stocking acts as a clamp on the limb, and I keep pointing to the leg because that's where it's most common, but a clamp on the leg prevents lymphatic fluid from infiltrating an area and basically engorging those tissues. So when you clamp an area with a compression stocking, it limits the capacity for those areas to fill up with lymphatic fluid. A pump moves it out, but it's only once or twice a day you're utilizing it. A stocking, like what you had on that you didn't wear today, very common, but if I had 10 people standing here and all 10 of them would, it's only about 20% in my interpretation. Very hard to get on. A lot of people dig into their skin when they're putting them on. They have the expense on there too. So there's a bunch of variables that a lot of people kind of get away from that. There is this, and this is becoming a more common application over the last 5 or 10 years. It's a garment that goes on. This one's for the leg, and then it has opposing Velcro straps that ratchet down. Not the fanciest, not the lightest, not the cheapest, but what this does is if it's very crucial for someone to edema gets so bad in the lower legs, they must clamp their limb. And if a stocking is not an option, traditional elastic stocking is not an option, this is probably the best and only option someone would have. So this slides on very easily, and then it clamps down through ratcheting opposing straps.
I want it.
Yeah, it's very helpful. It is very helpful.
Excuse me, would you put that on first thing in the morning before you've had a chance to pool?
Pull what?
The water to pool?
Oh, for water to pool. Yes, absolutely. So if you're laying down in bed over a period of 6 or 8 hours sleeping, and the lymphatic fluid has a chance to kind of redistribute to other areas, I won't get into that as far as diagnosing venous insufficiency or vascular edema versus lymphedema, because there is a little bit of difference. But yes, you would do that. You'd clamp the limb as soon as possible before you get on your feet, because you actually have a calf. The calf muscle structurally is what is our internal pump. So that's why exercise is important. A doctor will a lot of times in the 2 minutes they're seeing you, say exercise and change your diet. And that's what they'll say. But exercise, and particularly in the legs, when you incorporate more muscle tissue, it's an internal pump, and it actually helps remove some of those metabolites out of the lymphatic system that you need. It also helps return blood flow back to the heart, because the arteries that return blood flow down, the veins return blood flow back. So if you compress the limb, whether your own muscle or use of a compression stocking, it does help with some of those things. So clamping the leg is good.
How can we find some of those exercises, you know?
Well, the good thing is they're very simple. Some of the best ones are swimming, right? Riding a bike, and even just calf raises, standing. Those are actually some of the 3 best ones to do. And swimming is fantastic because a lot of people don't underestimate that when you're in a pool, 5 feet down is about 100 millimeters of mercury per square inch on the limb. And actually this pump today is set at 40. So the amount of compression you're getting here is 40 millimeters of mercury per square inch. Standing in a pool, you're getting about 100. A lot of people don't understand that. So that's standing in a pool. So the amount of compression, the pressure on the tissues down the legs are almost upwards of 100. So, and it does translate about the same. You can look that up. But the compression pumps, you know, they're very, very helpful for utilizing
What kind
them.
of exercise I can do?
Well,
besides,
that's where I would point you to the OTs or PTs, particularly here. You can talk to some of the therapists here, and you can ask them about how to open up and improve some of the pathways to reduce edema specifically zoned in an area, or you could do exercises that would help prevent future occurrences of edema from getting worse. Those are also possibilities. But in my 13 years doing this, I've noticed a lot of the therapists utilize those 3 techniques. Standing calf raises to improve the function of the calf and or flexibility, range of motion in the legs, stationary or out about, and then also utilizing the pool. Very common.
Walking is good too?
Yeah, absolutely. Walking is good. Yeah. So I'll keep it simple to that. If you guys have any questions regarding the pump or anything, just feel free to ask any of us.